Okay, so this is a new module. This is Dr. K, or Karagesian, going through this module. And this is all about cardiovascular um, uh, conditions, concepts. I think it's an interesting module. There's a lot to it, but we'll go through each slide and we'll make sense of it. So, I mean, obviously this first slide is more of a joke than anything else, but just remember the concept of cardiac arrest, because you're going to hear other cardiac diseases, and cardiac arrest just means what it says, that the heart has stopped pumping, and typically the electricity has become either absent or very irregular and non-functional, such as ventricular fibrillation. Don't worry about that word, we'll come to it again. So cardiac arrest is lack of electrical activity and lack of mechanical activity of the heart. The heart is not pumping any longer. Okay, so let's just start with an overview of the cardiovascular system. And really, when we think of the cardiovascular system, we're thinking of the heart, which is the pump, the vessels that are leaving the heart, which are the arteries. Then the arteries become smaller arteries called arterioles. The arterioles are heading to the different areas of the body, the different organs. They go and then become capillaries, which feed the different parts of the body. Those capillaries then become small veins called venules, which drain back into the venous system and finally returning to the right side of the heart. Okay, so really it's the heart as the pump, the arteries, which are typically leaving the heart, and the veins, which are returning blood to the heart. So the whole system is a closed system, okay? And we usually have approximately 5 liters of blood in our cardiovascular system as an adult. And the main purpose, transportation of oxygen, elimination of carbon dioxide through diffusion into the lungs, delivery of nutrients to different parts of the body, circulation of hormones to different target cells around the body, and elimination of metabolic waste, right? That can be eliminated typically by the kidney, and some elimination takes place by the liver as well. There's also the immune system that's in the blood that's constantly circulating and surveying for any potential source of infection. And remember, the cardiovascular system is very prone to disease. So whether we're talking about heart disease, arterial disease, or venous disease that we'll talk about, it's one of the leading causes of death in North America and the US. So when we say cardiovascular disease, we're talking about the heart, but also the vessels. So we would include strokes in that, since most strokes are caused by either a blockage of an artery, which is an ischemic stroke, or a rupture of an artery, which is a hemorrhagic stroke. Okay, so let's look at cardiac structure and anatomy. So the heart has 4 chambers. So the 2 upper chambers are the right and left atrium, and the 2 lower chambers are the right and left ventricle. So let's just follow the flow of blood through the heart, and then we'll talk about how the heart truly pumps. So on the right side of the heart is where you have your venous return of blood, which is deoxygenated, right? It's returning from all of those venules that gradually formed larger and larger veins and finally became the inferior vena cava and the superior vena cava. And the superior vena cava is really what drains the upper part of your body, your arms and your head and your upper chest. And the inferior vena cava is blood flow return from your legs and your abdominal cavity. And they meet in the right atrium. So blood flows from the right atrium to the right ventricle through the tricuspid valve. The right ventricle pumps the blood into the pulmonary artery, which through the pulmonary valve, and then bifurcates into the right and left pulmonary artery, which then will go to each lung and deliver CO2 that can be diffused across into the alveoli to be ventilated out, and of course to replenish the oxygen supply within the blood. Okay, so the pulmonary artery forms these huge branches of capillaries in each lung to perform oxygenation and diffusion of CO2. Then the blood returns to the left side of the heart through the pulmonary veins into the left atrium. So now this is oxygenated blood. Okay, the left atrium can allow flow of blood through the mitral valve into the left ventricle, and then finally the left ventricle can pump the oxygenated blood into the systemic circulation, so the arteries, through the aortic valve. Okay, so excuse me. So you can see that the left side of the heart, the left ventricle, is having to pump very, very high pressures in order to overcome the pressure that's in the aorta, which is your blood pressure. So typically, the left ventricle is a very powerful and thick muscle, okay, because it has to generate such high pressures. The right ventricle really doesn't have to generate very high pressures, since the blood that's flowing back into the right side of the heart is really just flowing back from the veins. They're under very low pressure. They return back into the right atrium and then into the right ventricle under low pressure. So the right ventricle does not require a very thick muscle compared to the left ventricle. Okay? So now, whenever we're looking at the heart, think about how the heart beats. So the right and left ventricle beat in unison, so together, and then the left and right ventricle beat in unison. So the top chambers, the upper chambers beat together, and then the right and left ventricle beat together. Okay, so you can imagine what's happening with the valves. So let's just do one heartbeat together. So the left and right atrium contract. Okay, so the tricuspid and mitral valve open, allowing blood to flow into the lower chambers, the ventricles, and then the lower chambers, the left and right ventricle, contract. Well, that causes immediate closure of the tricuspid and the mitral valve, and then the pulmonary valve and the aortic valve open to allow blood out of the ventricles. Okay? In general, we have about 5 liters of blood in our system. Okay, so as an adult, we contain about 5 liters of blood, and on average, we pump about 5 liters of blood per minute. So every minute, you're actually pumping your entire blood volume by your heart. Okay, and that number of liters can be significantly increased if the heart wants to increase cardiac output. So if the heart beats faster or beats harder, it can significantly increase 5 liters per minute to many, many more liters per minute if necessary. So you can imagine that since the left side of the heart is the higher pressure system that's having to work really hard to overcome the aortic pressure in order to pump blood into the aorta. And remember, your aorta is your systemic blood pressure. And so if you're thinking about a blood pressure of 120 over 80, well, your diastolic pressure is 80, and that is what your heart is pumping to overcome that pressure to allow blood to go from the left ventricle into the aorta. Okay? So your systolic blood pressure is actually at the end of systole, when all of the blood has left the left ventricle. And when your ventricles relax in diastole, your diastolic pressure is when the ventricles have relaxed and the pressure has gradually, or the blood has gradually gone through the capillaries, and now you're left with your diastolic pressure. Okay? So understand that concept of systolic versus diastolic pressure and what causes it. And you're going to see that many, many conditions occur more commonly on the left side of the heart, because that side of the heart is working much harder due to the higher pressures that it has to deal with. Okay, so the other thing to remember is that vessels that are flowing to the heart are veins. Vessels that are leaving the heart are arteries. And there's actually an artery that has deoxygenated blood in it, and that's the pulmonary artery, right? So if I asked you what artery in the body has deoxygenated blood, it would be the pulmonary artery, because typically arteries have oxygenated blood within them. So how does the heart beat with a rhythm? This slide is going to help us understand that a bit. The cardiac nervous system. When we say cardiac nervous system, we're not really kind of referring to like the central nervous system or the peripheral nervous system. So technically it's not a name in itself, but we're just going to talk about the nerves, the important nerves of the heart that send electrical signals to then cause the heart to contract. And the whole system starts at the SA node, the sinoatrial node. And that has its own pacemaker rhythm. It just goes on itself. So if we were to look at the SA node, it can depolarize and repolarize all by itself. So it initiates the beat or the electrical signal. And on average, that's about 60 to 100 signals per minute, which will then turn into the heart rate. So the SA node span the fibers, the nerve fibers span across both atrium, and then they finally end up at the AV node. Okay, you should know this sequence. After the AV node, the bundle is called the His fibers, the bundle of His. And notice that the AV node and the bundle of His, especially the AV node, is right at the junction between the atria, and the ventricles. After the His fibers, you have the right and left bundle branches, which then send the electrical wiring into the ventricles, and then they become little tiny fibers, little nerve fibers called Purkinje fibers. So any one of the, so the normal system is for the SA node to send a signal to then go to span across the atrium, end up at the AV node, and then travel to the His fibers, split into the left and right bundle fibers, and then finally end up at the Purkinje fibers that's going to send signals to the ventricles. Let's say the SA node isn't functioning anymore.
for whatever reason. And there was a heart attack there, and the SA node is damaged, or the SA node sometimes with age stops depolarizing, so it's not sending a signal. Well, the other ones that are listed there can act as pacemakers as well. So it's kind of like a safety network. Whereas if the main signal from the SA node stops working, well, the next one will take over, the next fastest one. So none of these are acting as pacemakers except for the SA node until the SA node is not functioning anymore, and the next one, the next fastest one will function. So that would be the AV node. If the AV node was completely non-functional, then the beating of the heart, which really is your ventricles beating. When we say your heartbeat, we're talking about the ventricles pumping blood into, or the left ventricle pumping blood to the systemic circulation. So if your AV node is not working and you can't conduct from the atrium to the ventricles, that's what we would call a complete AV block, or a third degree block, and we'll get to that. That's just a comment. So what's going to happen if you have an AV block? Something in the ventricle, like the bundle of His or the Purkinje fibers or the ventricles themselves, can depolarize. They can act as pacemakers themselves. So this is an overall safety mechanism, that if one part that was acting as a pacemaker, for example, the SA node, dies, someone else, some other part of the nervous system of the heart can take over. Okay? Now remember, this is the nervous system of the heart is what sends the signal for the heart to contract. So it sends a signal to the atrium, depolarizing the atrium and causing a atrial contraction, and then as the electrical signal goes into the ventricles, normally through the AV node down the bundle of His into the bundle branches, it'll cause a ventricular depolarization, which will then lead to ventricular contraction. And ventricular contraction is really what we call systole, so a systolic contraction of the heart. So when we're talking about systole and diastole, we're really talking about the ventricles. So during systole, the ventricles are contracting, and during diastole, the ventricles are relaxing. The other thing to remember is that the normal pumping of the heart is that the two atrium contract simultaneously, and then they relax. And then the two ventricles contract at the same time, and then they relax. Okay? So the top two chambers contract, then they relax, followed by the bottom two chambers, the two ventricles, and then they relax.